Hello everyone. I am Professor Ka-Kit Hui of UCLA David Gavin School of Medicine, Director of the Center for East-West Medicine. And I'm very pleased to be able to share with you my journey in integrative medicine, the development of the Center for East-West Medicine at UCLA, the development of integrative medicine in the United States. I will share with you our center's clinical approach, particularly how it may pertain to care of patients in the primary care environment. How I get involved with this project started way back in 2010. I wrote a paper, followed two previous papers that I wrote, one in 1999, talking about during the turn of the century, what type of healthcare leader would be needed for the paradigmic shift in terms of patients who are not dying from acute illness and now has developed chronic illnesses. So at that time, I proposed the idea for China, outpatient medicine should incorporate a lot more Chinese medicine. And for inpatient, even though Western medicine is dominant, Chinese medicine can also be quite helpful as well. And this paper was followed by my presentation at the WHO meeting in Awaji Island in Japan. And I talk about the potential of incorporating Chinese medicine in clinical practice in the contemporary modern Western world. At that time, I already talked about my concern for the healthcare crisis that is developing.
上海中西结合医学国际会议现在开幕。We are now facing a very important juncture for development of integrative medicine.
When I was invited to speak at the Shanghai International Integrative Medicine Conference, I introduced the idea about the importance of redesign the primary care system with an integrative health flavor to it, and the need to train a cadre of physicians who are versatile in both, so that many of the common problems were brought to the primary care setting can be solved. At that time, I written up in a major paper I wrote in 2011, stating that China is poised to build a better healthcare delivery system using the integrative health paradigm. Since the 1950s, China already embarked on the journey of integrative medicine, combining the best of Chinese and Western medicine to create something better than either health traditions. And I believe that this is the right direction, is to bring that into the emerging development of the primary healthcare system in China. So the important thing is to try to train more physicians that are trained originally in Western medicine and try to have them be more aware of the potential of incorporating Chinese medicine into either their own care of patients or to be able to collaborate with their Chinese medicine counterparts. And at the same time, there are so many graduates of traditional Chinese medicine schools who already have medical training that if they are brought into the primary care health system, the workforce will be much more versatile in solving many of the common problems that either healing traditions may be insufficient. So I share some of these ideas with the leadership of the health ministry in Shanghai, and I'm so glad that they are now embarking on this major project currently headed by my friend and colleague, Professor Wang Wenjian. What I'm going to do is to share with you a little bit about my background, and then through my development, how you can see the development of integrative medicine in the United States. And I'll share with you, besides our own center at UCLA, I would also share with you some of the other centers, such as Harvard or Duke University, and also University of Arizona. That was back in the late 1960s. First idea of integrative medicine is to find a new drug from the herbal pharmacopoeia. But in 1971-72, a major world event happened that President Nixon went to China, and James Reston, a columnist from the New York Times, went along, and at that time he was given acupuncture to relieve his post-op pain and also nausea. I was a young medical student at that time at UCLA studying neuroscience and was very intrigued how acupuncture may work. As I was studying Western medicine, I made up my mind that I would use my spare time, not that there's a lot of spare time during medical school, to study Chinese medicine mainly on my own. So I went back to Hong Kong, I learned acupuncture, I brought a lot of books and journals regarding Chinese medicine, integrative medicine, and then I would use what I learned from UCLA and compare with what I can learn from reading some of these interesting material coming out of China. And this continued beyond medical school and going forward to residency. I became a resident in internal medicine. And then I subspecialized in clinical pharmacology because I want to use internal medicine and clinical pharmacology to integrate Western medicine and see how clinical medicine linked to basic science. So over the first 20-some years at UCLA, I want to learn as much as I can about Western medicine in terms of its scientific basis, its theoretical construct, its strengths and weaknesses. I have been a super consultant in the hospital. I also have been working as a primary care physician. I have taught clinical pharmacology for 13 years. I developed drugs. I learned about drug development. And I work with endorphins, which at that time was thought to be mediating some of the effects of acupuncture. So that's sort of my first 20-some years. And I have published in a lot of major journals so that I can build up my credentials in Western medicine. Because at UCLA or in most of the universities in the United States, studying anything outside of Western medicine was thought to be a waste of time. But I know much better that Chinese medicine is a very, very useful healing traditions. Over the years, I have been reading up on the works of many top-notch integrators in China, such as Professor Chen Keqi, who is a cardiologist, Professor Wu Xianzhong, who is a surgeon who applied Chinese medicine to see how it can be useful in treating patients with acute abdomen. Professor Chen Jiyan, who is the mentor for Professor Wang Wenjian, an endocrinologist whose work I read for many years back in the late 60s and early 70s. His work on the kidney yang deficiency pattern. And Professor Han Jisang, obviously from Beijing Medical University, his research work on the neurochemical basis of acupuncture analgesia and subsequently its application in addiction and other conditions as well. And obviously, besides Professor Xie Zhufan and also Li Chunsheng, all from Beijing, I also have been reading up and befriend Professor Yu Jing, who is from Fudan, OBGYN. Obviously have learned from many of these pioneers of integrative medicine in China so that I become more confident later on as I progress in my own career in Western medicine that this is the direction that I am going to take. So back in 1993, during that year, I already have decided to launch the Center for East-West Medicine. The idea is to not just to do more research, but to try to blend the best of Chinese and Western medicine to create a healthcare model that will be helpful not just for the person, but also for society as well. My mentor of 40-some years, Dean Sherman Melankoff, who built UCLA from a new medical school to a world-renowned health institution during a time when he was dean from 1960s to 1985. After he retired, he over the years have encouraged me to pursue this dream, but it wasn't until after many years that I dared to launch the center, because I think that the timing is right. I was more ready to do it. And obviously, without my late wife's support and many volunteers and patients and donors, the center would not have been launched. But more importantly, I try to emphasize that the current health system based on Western medicine is unsustainable, and that it is important to have a new health model by blending the preventative whole system approach of Chinese medicine with the reductionistic and acute crisis management strength of Western medicine. So when I first started the center, I started with the clinic, because I know that you have to demonstrate its value in the clinic, but to try to make it relevant, to demonstrate the value of Chinese medicine. And obviously, there is oftentimes no reimbursement for acupuncture. The reimbursement for massage is very low. And I will tell you a bit later in the second segment how I have developed a viable clinical model at our center clinic that now has become very successful, widely accepted at UCLA after 20 years. We have been so successful in integrative medicine as a university when Vice Minister of Health and the State Commissioner of the State Administration of Traditional Chinese Medicine, Wang Guoqiang, he came to UCLA to look at how integrative medicine is developed in the United States. What it needs is to incorporate the integrative East-West health paradigm. So we need to train more people, and I believe that you all are going to be demonstrating for the world how an integrative East-West health paradigm would work much better in the community, in primary care, and that this would be an example for the rest of the world to emulate.